While colorectal cancer is not talked about as much as other forms of cancer, it is the third leading cancer in the United States. We are now seeing an increase in younger people under 55 developing these tumors. Why might this be? Let's talk about it. Hey everybody, it's Dr. David. So I was recently reading about this increase in colorectal cancer in younger people, and then a local news affiliate reached out and asked me for a comment about it. So I figured, hey, let's make a video on it. So certainly in the pediatric world, colorectal cancer, it's not a thing. This is certainly a disease of adults. But of course, I know lots of parents and grandparents watch this. And of course, if this is due to what we think it is, which is poor lifestyle, sedentary lifestyles, poor diet, then establishing those things properly in early life can be preventive later in life. So that's what we're going to get into today. Okay. Now, let's first talk about this. So colorectal cancer, okay? So there's colon cancer, there's rectal cancer, and then it can actually cross over. So as you may know, the colon is the large intestine. Starts where the appendix is, down here, comes up, comes over, goes down, and then it leads into the rectum, which is the last part of the colon, okay? Now this is different than anal cancer, which is the pucker. Okay, and anal cancer is usually caused by HPV, the same thing that causes cervical cancer as a sexually transmitted disease. This is different. Okay, so colon cancer, rectal cancer together, if it's involving both, colorectal cancer, but it is the same type of tumor for that. Adenocarcinoma. So that's why people will talk about colorectal cancer in the same breath, even though some people could just have it in the colon or could just have it in the rectum, but it's the general term used for these adenocarcinomas. Okay. Now, usually first, they develop from a polyp. Okay. And not all polyps, though, become cancerous, but they usually do come from a polyp. And that's something important to understand because that's where prevention can be very helpful. Okay. Now, over 150,000 Americans are diagnosed with colorectal cancer every year. So as I said, this is a common thing, okay? But we've seen over the past few decades in America, there's just this an overall increase in colorectal cancer. And in people under the age of 55, those who received the diagnosis increased. It was 11% of people under age 55 who were getting the diagnosis in 1995, but now it's up to 20% in 2019. So about 14 years later, and this is according to the American Cancer Society. So a larger percentage of people under the age of 55 overall diagnoses of cancer. So it's a larger percentage of younger adults now. Not larger than older adults, but larger than what it used to be, more than double that amount. Okay. Now, what they did find is that the rates among 65 and older has actually decreased since 2011. So things are getting through, obviously, when you're older in life. People who, maybe they don't get the recommended screening done at 40, 45, 50. Maybe they decide to do it at 55, 60, 70, etc. So, maybe people are screening and finding things earlier are causing a problem. But overall, that is a thing that it seems to be developing more in younger people, and less in older people. Okay, so 75% of all colon cancers could be avoided according to the American Cancer Society. Okay, and so there are things that people can do, and first and foremost is screening. Okay. Now, it is recommended to start colorectal screening at 45 years of age, but at 40 or 10 years younger than the youngest person in the family, if there is a family history of colorectal cancer. So if there's somebody in your family who had colorectal cancer at 40, you should be screening at 30. Okay, but other people who don't have that risk, 45 is when it typically starts. Okay, now, as you probably know, there are different forms of colon cancer screening. The most reliable by far is a colonoscopy. Okay, it's not pleasant. The prep itself is not pleasant. The river's going to run through you most likely, as you have to clean it all out ahead of time. But, you have to go into a center to get it done. It's not a home test. But the advantage here is that the doctor can see the entire colon, and in particular can see polyps that may be precancerous, and they can check for that. And of course, if it's, and if there is a concern about that, they can biopsy it. You can go back in and even remove some if necessary in a second, but hopefully they catch it in the first time. But if you biopsy it, you can see what it is. And if it's, oh, that's just a benign polyp, it's okay, versus, oh, this is precancerous, or for that matter, hey, this is cancerous, you're going to catch it earlier before the symptoms get started. That's the reason why the screening and the colonoscopy is so important. But it does take about 30 to 60 minutes, which isn't pleasant. You have to take the day off usually for that. But it does catch 92% of the cancers, okay? But again, it's preventive, and it's the only way that's preventive since the precancerous polyps are found. Now, there are other types of stool tests, one called the Cologuard. This is relatively new. It's a stool sample, okay? But it's not preventive, okay? It catches cancer early before it becomes a problem, because it's looking for DNA, abnormal DNA that's found in colon cancer tumor cells that are not part of human regular colon cells. And so it's if that DNA is there, it's a sign that the cancer is there, even if person's asymptomatic. But if there's a polyp there, obviously it could be shedding it off. The test also looks for blood in the stool, which in and of itself is also a sign. Of course, if a person sees blood in their stool, that's going to be alarming. But there could be microscopic blood that doesn't get to the point where you would see it on the tissue paper or see it in the toilet. Okay, but certainly if the DNA is there, you have cancer. Okay, and of course, you'd rather know that early as opposed to later when it's advanced metastasized. So it's still not a thing not to do, but again, doesn't get that prevention there. Okay, now as far as the now the other one, now in the old school way of doing it is just doing a stool sample for blood. Okay, it's by far the least expensive way of going, and if a cancer's there, it does catch it 71% of the time, but it more likely there's more symptoms if the blood is there, right? If there's damaged cells, if there's friable cancerous cells growing out, usually tumors have more blood flow to them. So if you're actually seeing the blood in the stool, even because the DNA may be there, but you're not seeing the blood on the stool, that probably means you're not as far along. Blood in the stool, you're further along. That's why we want to catch it early. Okay. Now, what has also been discovered, and this falls right in line with all of the stuff that we've been talking about from a functional medicine perspective, from a holistic perspective, from a healthy life perspective. It is felt that much of cancer, colon cancer, can be prevented by a person's lifestyle. Okay. So first of all, keeping a healthy body weight. Okay, a body mass index between 18.5 and 24.9 is considered ideal. Now, that's not true for everybody, because for very muscular people, this is a known thing. For like NFL players, for instance, who have a high body mass index because they're all muscle. So that's not true. But overall, for most general people, the further your body mass index is over 25, the more obese that a person is, especially as you get to the 30, 35, 40. And that is a risk factor. Obesity is a risk factor for colon cancer. Okay. Another thing, smoking. Now, thankfully, most people, we see, cigarette smoking is at the lowest point it's ever been. Okay. And that's obviously really, really good. But and there's this concept in medicine called pack years. How many packs per day for how many years? So if you smoke 1 pack a day, and what they found is that if a person has more than 29 pack years in their history, that in and of itself is associated with a 61% increase in colon cancer. So that means if a person smoked 1 pack a day for 30 years, they would be there. If they smoked 2 packs a day for 15 years, that's 30 pack years as well. So the more a person smokes and the longer that they smoke, that's what's called the pack year, and that is an increased risk. Okay, alcohol. Alcohol consumption is a risk for colon cancer. There's a 47% increase in distal colon cancer, so the last part of the colon, in what are moderate drinkers. Okay, but even amongst light drinkers, there's a 14% increased risk of rectal cancer in light drinkers. Okay, and as we've talked about before, for the brain, for everything, the only safe amount of alcohol consumption is 0. And I realize that's probably not going to happen for most people, but now you have the facts so you can make the best decisions for yourself. Okay. Diet. Limiting red meat, but also limiting processed foods and ultra-processed foods. Okay. High consumption of mammal meat. Okay. So we're not talking about poultry. We're not talking about fish. Mammal meat in particular. But high consumption does increase the risk of colorectal cancer by 28%. Okay, a high consumption of of processed meats, in particular, like deli meats, sausages, pastrami's, bologna's, not necessarily 100% turkey. Well, again, that's poultry, anyways. But any roast beef that is not cured, that could be okay. But poultry, but processed meats, that in of itself goes up another 20%. Okay, and then for ultra processed foods themselves, okay, recent studies showed that those who do consume the most amount of ultra processed foods, so we're talking about foods that you can't pronounce the foods and label, that have all kinds of additives, a lot of processing to turn X into Y. That also has a 29% increase in developing colorectal cancer in men. This recent study that I'm quoting is in men in particular, and that was compared to men who ate the least amount. Now, do I suspect it's probably the same thing for women? Yes, but this particular most recent study was men, so that's what I'm reporting on. Okay. Now, this is a mainstream concept now. Having good vitamin D levels. Vitamin D deficiency is a risk factor for colorectal cancer. And as you've probably heard me say umpteen times, you want to get that level at least 50 nanograms per deciliter. So getting above 50, super important. But they've also shown calcium deficiency is an issue. So adults, they should be getting at least 600 milligrams of calcium per day, especially if they have a good vitamin D level. They don't need more than that, even though the recommended daily allowance, the RDA, is 1,000 milligrams. It's actually, that's not needed if you have a good vitamin D level above 50. Okay. And then the other thing, again, just as we keep talking about, eating whole foods, eating whole grains, high consumptions of fiber. Okay. Tending to that microbiome. The microbiome is so involved with keeping our immune system from being able to recognize things, stopping oxidative damage, which is some of the cellular injury that can happen to DNA that can turn things into cancer, etc. So making sure that you have a good, healthy microbiome, eating lots of good fermented foods, prebiotics, taking probiotics if you're not eating enough fermented foods. That is also considered part of the mainstream approach to preventing colorectal cancer now. So, certainly if you've been following this channel and talking about the things that we're talking about, I realize it almost seems like a broken record because those same lifestyle things seem to help with everything, but doesn't that just mean that we are eating healthy and living healthy? It does. We need to be exercising. Didn't throw that in there when talking about weight, but certainly making sure a person is not sedentary. We all should be exercising close to an hour, if not 45 minutes, most days of the week. Walking is better than nothing. Getting your heart rate up is better than just walking. All right, so hope you can prevent colon cancer in you and your offspring. Pardon me, as life goes on. Have a nice day.